my name is Diana Vera, and today I will be demonstrating non-parental medication administration. So I will first start by comparing my physician orders with the MAR. So I will start with the name, Buzzard Jack, MRI number 87134651, 87134651. Date of birth, 6/20/19XX. Date of birth, 6/20/19XX. I will then move on to the medication. 8:30, Cefaclor, 500 milligrams POQ 4 hours for injection. Cefaclor, 500 milligrams POQ 4 hours for infection. 8:30. That matches. 8:30, Synthroid, 100 micrograms POQAM. Synthroid, 100 micrograms POQAM. 8:30. That matches as well. Nitrobit 2% ointment, topical QAM. 8:30, 1 inch on patient's chest. Nitrobit 2% ointment, topical QAM. 8:30, 1 inch on patient's chest. That matches as well. So they both match. Now we can move on to doing the first check. So the first check will be me pulling my medication. So I have my medication, and I will also grab my drug book, my nursing drug reference, and I will make sure that the dose that we are the dose that we will be giving the patient is appropriate and safe. So I will start with Cefaclor. So for Cefaclor, the action is it inhibits bacterial cell wall synthesis, renders cell wall osmotically unstable, leads to cell death by binding cell wall membrane. Uses for this medication is respiratory tract, urinary tract, skin, infections. The contraindications, hypersensitivity to cephalosporins or related antibiotic seizures. Precautions, pregnancy, breastfeeding, children, GI renal disease, diabetes mellitus. So for this dosage, for adults, PO, 250 to 500 milligrams, Q8 hours. So the order says 500 milligrams, PO, Q4 hours. So for the book, we'll do the max, which is 500, Q8 hours, which is 3 doses in 1 day. So 500 times 3, 500, multiply that by 3, equals 1500 milligrams. Then we will multiply the order that we were given. 500, multiply that. Q4 hours equals to 6 doses in 1 day. So 500, multiply that by 6, equals to 3000 milligrams. Due to that being double the amount that the book says, we will then contact the provider and make sure that that is the correct dose that he wants us to give the patient. We will then also do the dosage calculation of this. For Cefaclor, 500 milligrams, that is what we are ordered. And we are given 250 milligrams per 5 ml. So we would do the ordered, which is 500 over 250, the given, and we multiply that by 5 ml. So 500, we divide that by 250. Hold on. 500 divide that by 250 equals 2, and we multiply that by 5 ml, which equals 10 ml. So that is the amount we will be giving of Cefaclor. Now we will move on to the next medication, which is Synthroid, which is the tablet. So for Synthroid, the generic name is levothyroxine. The action is it increases metabolic rate, controls protein synthesis, increases cardiac output, renal blood. Uses hypothyroidism, myxedema coma, thyroid hormone replacement. Contraindications, adrenal insufficiency, recent MI, thyroid toxicosis. Precautions, pregnancy, breastfeeding, geriatric patients, angina pectoris. So for this dosage and routes, adults less than 50 years old, PO, the average dose 100 to 200 micrograms a day. The order says 100 micrograms per day as well. So this is actually a safe dose to give to this patient. We will now move on to the next medication, which is the Nitrobit 2% ointment. And the generic name is nitroglycerin. The action is it decreases preload and afterload, which are responsible for decreasing left ventricular and diastolic pressure, systemic vascular resistance. Uses are chronic stable angina pectoris, prophylaxis of angina pain, HF, acute, MI. Contraindications, hypersensitivity to the product of nitrates. So for this dosage, we will look up the topical ointment, and this is to administer topical ointment. You should be, should be measured on paper supplied, which is the one that we have. Use paper to spread on non-hairy area of chest, abdomen, thigh skin, thin layers, spread over 2 to 3 inches, do not rub. The order says 1 inch on patient's chest. So this is less than what the book says, so we would also contact the provider and make sure that this is the amount that he wants us to give the patient. So now I will move on to my second check. So I will now prepare my medication. So I will perform hand hygiene. I will then put on my gloves. Now that I have my gloves on, I will now grab the first medication, which is Cefaclor. I will grab the med cup. I will put this where I can see the 10 mLs. I will go to eye level. I will pour it in the med cup to 10 mLs. That is what we calculated when we did the dosage calculation. Now we'll move on to the next medication, which is Synthroid. And that is the tablet. Here's the tablet. I will open it and I will make sure that I do not touch the medication. Now that the medication is there, I will now grab the next medication, which is the Nitrobid 2% ointment. Here's the ointment, and I will take that with me as well. So now that I have prepared all of my medication, I will now perform hand hygiene. Remove my gloves, then perform hand hygiene. Okay, so I have completed that, and that was my second check. Now we'll start my third check, and this is prior to giving the medication to the patient on the bedside. So I will go to my patient's room. They have allowed me to come in. I close the door, I provide privacy, and I introduce myself. Hi, my name is Diana, and today I will be your nurse. Could I please have your first and last name? He tells me his first and last name. I check the ID band, it matches. I then explain that I will be giving him his medication. Hello, I'm here to give you your 8:30 medication due, and is that okay with you? He says yes. I ask him if he has any known allergies. He says no. So I have all my supplies with me. I will perform hand hygiene. I will put on my gloves. I will now raise the bed to an appropriate height level. I will raise the patient's head of the bed, and I will ask him if he's had any trouble swallowing or eating or drinking anything. He says no. So now I will give my patient his medications. So I will start first with the Cefaclor. He takes the Cefaclor. I now give him the Synthroid pill. He takes his medication. And now I will ask him if he has a patch on him at the moment, if he has any ointment patch. And he says yes. So now I will remove the patch. He says it's on his right arm, so I remove it. And now I will dispose of my gloves. I perform hand hygiene, and I will put on new gloves. So now that I have my new gloves on, I will now grab the ointment and my paper, and I will make sure that I put 1 inch of this Nitrobid 2% ointment on the piece of paper. So now that I have that ointment on that piece of paper, I will now place this patch on the patient's left arm, since he had one previously in the right arm. So I put the patch on the patient's arm, and I will also time, date, initial it, and I will put the 1 inch ointment that we put on the patient. So that is on there now. I will now remove my gloves, perform hand hygiene. Now that I have done all of that, I will dispose of all of the med cups, everything that I have there, put everything up that needs to be put up, and I will then lower the patient's bed to the lowest level. I will ask him if he is comfortable, and he said he is comfortable. I put the call light at reach. I tell him that if he needs anything to press, let us know. I will put the bed alarm if he is on a fall precaution to reduce any falls. And now I will exit the room, close the door. I will perform hand hygiene again. And I will document everything that I have done in the patient's room. So that was me completing the third check by giving the before giving the medications on the bedside, next to prior to giving the medication at bedside of the patient. So now I will verbalize medications, other medications that I would be giving. So I will start by the oral, sublingual, and buccal medication. So for these medications, for the sublingual, this goes under the tongue. The buccal goes between the cheek and the gum. I will explain to the patient that he should not eat or drink anything with this. He should not chew on it. He should just let it fully dissolve. So that is how we do sublingual and buccal medications. For eye drops, I will make sure to perform hand hygiene. I will put on my gloves. I will explain to the patient that I will be giving him, administering eye drops and ointment. I will also let him know that he could also experience some burning sensation. So I will start by grabbing a cotton ball. I will lay the patient flat, and I will lower his eyelid with the cotton ball. I will tell him to look at the ceiling, and I will place the eye drops, and then I will massage the nasal duct, and then I will tell him to gently close his eyelids. Now for the ointment, I'll do the same thing. Grab a cotton ball, lower the eyelid. I'll place the ointment, and then I will also tell him to lightly close his eyes. And that is how we complete eye drops. So I would then remove my gloves, perform hand hygiene. So now for eardrops. For eardrops, we will lay the patient to his side. So if he's laying on his left side, I will then place the eardrops in the above the ear canal, and I will let the patient know that he should lay in that same position on his left side for 5 minutes. And that is how we would do eardrops. And now will we do the nasal drops. So for the nasal drops, we will also lay the patient flat. I will tell the patient to tilt his head back, and we will place the nasal drops into the nose, and I will also let them know that they should lay flat for 5 minutes after administration. And that is how we conclude nasal drops. So now we will start the enema, administering the enema. So for the enema, we will grab all of our supplies, we will perform hand hygiene, we will put on our gloves. So I'll explain to the patient that we will be administering an enema, and that he should lay flat, turn to his left side, and raise and flex his knee up, his right knee up into a Sims position. I will then place 3 to 4 inches of lubricant on the tip of the enema tube, and I will let the patient know. I'll ask the patient, relax, slow deep breaths. I'm going to now insert the tubing. I will then spread the buttocks I will enter the tubing 3 to 4 inches. I will then hold the tubing in place, and I will then grab the little um, tube, the little container to squeeze the fluid in gently. And I want, as a patient, slow deep breaths. I will then, once the fluid has all gone in, I will then remove the tubing. I will make sure to use a towel on the tube at the end of the tube so that we don't make a mess. We will then dispose of the enema. I will explain to the patient that it can take 5 to 15 minutes for the solution to work, and it's different for everybody. So it could work, it could not work. So it's just different on everybody. Um, I will also make sure that the patient has a bedpan at reach, a bedside commode at reach, or if the patient is ambulating to the restroom, that we are there to help them, and that we can also provide perineal care if that's needed. So then I will lower the bed to the lowest position. Um, I will dispose of my gloves. I will perform hand hygiene. I will make sure the patient is at a comfortable position. I will put the call light at reach. I will put the bed alarm on to make sure the patient does not fall, and I'll let them know if they need anything to let us know. I'll let him know if he needs anything prior to the 30 minutes of me coming back to call. So now that I have done all of that, I will then make sure I have disposed of everything. Nothing is in the patient's room that should not be. I will leave the room. I will then close the door, perform hand hygiene, and I will make sure to document everything that I have done, time, date, the procedures that were done. And that is how we conclude self-administration of, um, sorry, that is how we conclude non-parental medication administration. Thank you.